Donald Trump has named one of the Affordable Care Act's biggest critics, Georgia Congressman Tom Price, to run the Department of Health and Human Services. Republicans in Congress have voted dozens of times to repeal the law known as Obamacare. Though it's not exactly clear what would take its place, healthcare providers will be watching closely. Common Ground in Wisconsin runs a nonprofit healthcare cooperative under the ACA, which covers 18,000 people. And we're talking now with Kathy Mahaffey, CEO of the Common Ground Healthcare Cooperative. Thanks very much for being with us today.
Well, thanks for having me, Mike.
So there are a lot of questions right now about the future of the Affordable Care Act. What do you tell the 18,000 people you're serving?
Well, you're right. There's a lot of uncertainty and a lot of concern by our members, but we're really telling them, it's business as usual. Our concern is that our members, are thinking that perhaps, that they'll lose their health insurance, and as early as January of 2017. And we don't want them to think that. So we're trying to impress upon our members the importance of continuing their health insurance plan. So it's open enrollment right now.
And are people enrolling?
They are. We're having some enrollment success this year with new members, but also our existing members are renewing their health plans. So we really haven't seen an impact.
Well, what is your personal reaction when you hear talk about we're going to repeal it and replace it? What would you like to see happen if indeed that is the direction they're moving?
Right. I think there's no disputing that there are changes needed to the Affordable Care Act, but I think that it has to be done very thoughtfully, carefully, and really with enough time. There are certain elements of the Affordable Care Act that have worked, and there's others that, need some adjustments. And so I'm really hopeful that the new administration will take the time that's needed to really examine those. I think that, I've heard, that the new administration likes the guarantee issue provision. And I agree, from a consumer perspective, that's very important to be able to get health insurance no matter your medical history. But on the other side, there's been talk about the individual, the mandate to have coverage and the penalty and how that's been ineffective. I agree, it hasn't been as effective. But those two components are directly related to one another. So, it's going to take time. This is very complex, and I hope that, that time is given so that, a true replacement is very effective.
You hear particularly Republicans talk about the Affordable Care Act just being a failure, that it has not worked. And I'm wondering if you'd respond. I mean, your experience is Common Ground has lost money. You were one of the relatively few number of cooperatives. Most of them are no longer in the business. Rate increases have been higher than I think you would like, or certainly the people you serve would like. Doesn't that kind of say that this didn't work, or that it didn't do what it was intended to do?
I believe that there are certain parts of the Affordable Care Act that have worked very well. We are covering more people now than we have in the past. What we hear from our members is that the subsidies that they receive and the benefits they've received are far better than they've ever had in the past. But it's true, there's other parts of this that just have not worked. From our perspective, the funding elements that were part of the Affordable Care Act to help health plans through all of these changes have failed. And so that's contributed to our losses in health plans around the country. But, I always looked at this as phase one. This is the first step in taking, some steps to improve the system. Knew that there would be tweaks necessary as we moved along, and it doesn't get to address really the true costs of healthcare. So this is step one, phase one, and we need to move on to the next phase. But I don't believe to just completely take what we've already built over the last 3 years and scrap it is the right way.
What's been the biggest surprise in this for you? Has it been the fact that not as many young and healthy people have signed up as everybody expected?
Yes, I think that's absolutely one of the biggest surprises, is because, the whole intent here was to get everyone, buying health insurance, and we need a balanced risk pool in order to do that. Our experience has been that, folks roughly between the ages of 45 and 64 are buying the health insurance. They have multiple chronic conditions, they have needs, and we're not seeing that younger population. And there's multiple reasons for that. Again, I referred to the mandate maybe not being as effective as it could, but also, the promise by the current administration about if you like your health plan, you can keep it. And the fact that there's these non-ACA compliant plans still available out in the marketplace that are less costly because they don't have all of the new provisions has had a damaging impact.
So it is true to say we'll have to stay tuned. There's a lot that we don't know at this time, but you're saying in the meantime, people should stay with their plans.
Absolutely.
All right. Kathy Mahaffey from Common Ground. We appreciate today. Thanks very much for being with us.
Thank you.
Coming up next, surveying the Democratic field for governor in 2018.